cut your finger right now. What's the first thing you do? Run cold water? Apply antiseptic? Maybe wrap a bandage? Take an ibuprofen if it hurts? For 99% of human history, none of that existed. No pharmacy, no hospital, no painkillers, no surgeons, no antibiotics. So what did your ancestors do when they got hurt? The answer is darker and weirder than you think. And one of their treatments is still considered cutting-edge medicine today. The stakes. Imagine breaking your arm 50,000 years ago. There is no cast, no painkillers, no surgery. The bone might never heal straight. You might lose the arm to infection. You might die from the shock. Now multiply that by every illness you've ever heard of. Tooth abscesses, snake bites, fevers, childbirth, burns, wounds from hunts. Every single one of these killed people for hundreds of thousands of years. And yet, humans survived. Not by accident, by knowledge passed from grandmother to mother to daughter. Every generation refining what worked. Treatment 1. The oldest painkiller on Earth. Around 60,000 years ago, in a cave in Iraq called Shanidar, archaeologists found a Neanderthal skeleton buried with flowers. They also found something in his teeth, traces of yarrow and chamomile. Both are still used today as anti-inflammatory medicine. But the real discovery came from a different bone. Ground into the tooth plaque was willow bark. Willow bark contains a chemical called salicin. Your body converts it into acetylsalicylic acid. You know that by another name, aspirin. Your ancestors discovered aspirin 60,000 years before modern science isolated it. They chewed willow bark for headaches, for fevers, for pain. The same drug doctors prescribe today. They figured it out by watching what worked, by trying, by dying, and by remembering. Treatment 2. Honey as an antibiotic. In 1862, an American businessman bought a 4,500-year-old Egyptian medical scroll. It contained over 700 healing recipes. Many of them used the same ingredient again and again. Honey. Egyptians used honey to treat burns, to pack open wounds, to prevent infection in surgical cuts. They believed it kept the gods of disease away. They were right, they just didn't know why. Modern science now understands honey contains hydrogen peroxide, low pH, and an enzyme that kills bacteria on contact. In 2007, the FDA approved medical-grade honey for treating chronic wounds. Hospitals in Europe now use it on burn patients who don't respond to antibiotics. Your great-great-great-grandmother already knew this. So did her great-great-great-grandmother. We forgot, and then we paid to relearn it. Treatment 3. Maggots. This one is hard to read, but it is real. For thousands of years, when a wound became infected with dead, rotting flesh, ancient humans did something most modern people would never accept. They placed maggots on the wound. The maggots only eat dead tissue. They leave the living tissue alone. They clean the wound deeper than any surgeon ever could. They also secrete a chemical that kills bacteria. Roman soldiers used them. Mayan healers used them. American Civil War doctors used them on the worst battlefield wounds. And in 2004, the FDA officially approved medical maggot therapy for diabetic wounds, burns, and pressure ulcers that won't heal. The same therapy that disgusts you was saving lives 2,000 years ago, and it's still saving lives today. Treatment 4. Drilling holes in the skull. Now, here's the wildest one. Across every continent, archaeologists have found ancient human skulls with neat, round holes drilled into them. This procedure is called trepanation. It is the oldest surgery in human history. People used to think these were execution wounds, but then they noticed something. The bone around the hole had healed, which means the patient survived. Not just survived, lived for years afterward. We have skulls with 2 holes, some with 4. Some patients clearly had multiple trepanations over decades. Why would anyone do this? To release pressure from head injuries, to treat seizures, to cure migraines, to let out evil spirits, depending on the culture. And here's the part that breaks every assumption. The survival rate of ancient trepanation was around 70%, higher than the survival rate of brain surgery in the 1700s. We weren't just guessing in the dark. We were performing successful brain surgery before we invented the wheel. Treatment 5. Tattoos as medicine. In 1991, when two hikers found Otzi the Iceman frozen in the Alps, scientists discovered something unexpected. His body had 61 tattoos. They weren't decorative. They were placed at specific points along his joints, lower back, and ankles. When modern doctors mapped these points, they discovered something incredible. Every single tattoo lined up with classical acupuncture points used today. Otzi had arthritis. His tattoos were treatment. A 5,300-year-old man in Europe was using the same medical map that Chinese acupuncturists would systematize 3,000 years later. The knowledge didn't come from China. It came from somewhere far older, from the simple human observation that pressing or burning certain spots on the body relieved pain. The map of pain was ancient. We just gave it new names. The emotional human story. In 1957, archaeologists working in Shanidar cave found another Neanderthal skeleton, different from the one with willow bark in his teeth. This one had a different story. He was crushed on one side. His skull was caved in. His right arm had been amputated at the elbow, possibly because of injury, possibly because of disease. He was blind in his left eye. He had severe arthritis and a withered leg. He could not hunt. He could not gather. He couldn't even feed himself properly. And yet, he lived to 40, decades after his injuries happened, which means his group kept him alive. They fed him, they protected him, they carried him, they treated his wounds. They cared for him for years, knowing he would never repay them in food or labor. Healing isn't just about plants and surgery. It's about somebody being willing to keep you alive when you can't keep yourself alive. That's not modern medicine. That's something much older, something we built into the human species long before we ever invented hospitals. Look at your finger again, the same one. For 300,000 years, healing was a community skill. Everyone knew the basics. Older women taught younger women, healers passed knowledge to their apprentices, plants were learned by trial, error, and word of mouth. And then, around 200 years ago, something changed. Medicine became a profession. Doctors were trained in universities. Plants were replaced with patented chemicals. Knowledge that had been passed down for thousands of years was suddenly considered primitive and forgotten. Some of it deserved to be forgotten. Some of it was useless, some of it was dangerous, but a lot of it worked. The honey, the willow bark, the maggots, the acupuncture, the careful setting of broken bones, these were not myths. They were the result of hundreds of thousands of years of human trial and error, and we threw most of it away. The modern parallel. Today, when you cut your finger, you reach for antiseptic. When you have a headache, you reach for aspirin. When you have a wound that won't heal, you might receive medical-grade honey or maggot therapy at a top hospital. Every single one of these is ancient medicine, repackaged, retested, and sold back to you at modern prices. Your ancestors didn't have laboratories. They had observation, memory, and time. They watched what worked. They remembered what killed people. They wrote it down on bones, on cave walls, on papyrus scrolls. And every single time we discover a new natural remedy, we are usually rediscovering something a tribe figured out 10,000 years ago. We didn't invent healing. We just systematized what was already there. Look at your finger again, the same one you imagined cutting at the start of this video. Now imagine it 50,000 years ago. There would be no pharmacy, no urgent care, no antibiotics, but there would be someone next to you who knew exactly what to do. They would chew willow bark and press it into the cut. They would smear it with honey. They would wrap it in clean leaves. They would stay awake with you through the night to make sure you didn't develop a fever. Modern medicine saves lives every day. But it didn't start in laboratories. It started in caves. It started with mothers and grandmothers and quiet healers who watched the world and learned what saved people. You are alive today because they paid attention. Subscribe for more stories about the people who came before. And tell me in the comments, what's one home remedy you grew up with that you now realize might be thousands of years old?